Hi, I'm Paula Marshall, family nurse practitioner here at Highpoint Health Wound Care at Sumner and Riverview. I'm from Maryland, Prince George's County, Maryland. Grew up right outside the district. Got my associates in nursing at the community college there in PG. My first job was in transplant at a big hospital center in DC. Loved it, loved every minute of it. Had the opportunity to move to Ohio and continue in abdominal transplant. Also had the opportunity to go back to school, get my bachelor's there. In 2007, my folks had retired down here in Tennessee, and my sister and I followed them. Couldn't find a job in transplant. Found a colorectal unit. It was a post-op floor, and I learned everything ostomy. It was wonderful. Got to work hand in hand with the wound ostomy nurses and thought that would be something I would love to do. So I pursued that. Emory had a program for wound ostomy nurses, and I did that in about a year. And it just so happened that Sumner was looking for an inpatient wound ostomy nurse when I finished, and they hired me as their first wound ostomy nurse, which was awesome. COVID hit in 2020, and I had a little persuasion maybe to go back to school and pursue a little deeper study where I could utilize my wound ostomy background, but as a practitioner. And so I went to Frontier Nursing University and finished my family nurse practitioner there. Wound care, I think I had always loved it, even on the post-op floors. If anybody needed a dressing change, that's just something that I volunteered to do. When I was working at Vandy on the colorectal unit, and we utilized the wound ostomy nurse, I think is where my love for wound care and ostomy care came in. They would come into the room for a patient who had just been told, you're going to have a bag on your belly for the rest of your life. And they gave them, the tools they needed to continue to live out the rest of their days in comfort, not feeling alienated. I think they're a piece of the puzzle that nobody knows is missing. And I think that's what wound care is in itself, is a big puzzle piece. People come into wound care and pressure ulcer or diabetic foot ulcer or a venous ulcer. Those are the simple ones. And if we can just find the piece of the puzzle that's missing, they heal right up. They think we're miracle workers when really we're just working with them to find out what puzzle piece is missing. Like I said, in 2012, Sumner gave me the opportunity right out of wound ostomy certification to come and work for them in the hospital. Loved every minute of it. Wound care had an opening where I could work 4 days a week. Absolutely fell in love with wound care. Love the people of Gallatin, go to church in Gallatin. My sister's in Smith County, so when the opportunity came up to service Smith County residents at Riverview, I jumped on the chance. Visit at wound care, you're greeted by our friendly front office staff. Our intake nurse will come and pick you up in the front lobby, and she'll bring you back. The first visit with us is probably the longest, but like I had said, there's a bunch of puzzle pieces that we're trying to figure out. So she's asking a bunch of questions. She's forming a couple exams, especially if you're a diabetic or if this is a venous ulcer. There's little exams we do in clinic. Kind of gives us some information. Once she's completed her portion of the tests or questions, then I come in with a case manager, and I get to sit with you. We get to discuss your wound. We get to discuss your care plan and what you would like done, kind of what path you fall on, what options you have, what choices you have. And when we're in agreement, then our discharge nurse comes in, and she'll get you wrapped up or dressing on, and we'll stop at the desk, make an appointment for the next visit. We usually see you weekly. How we see you in the first place is usually referral. Primary care doctors are a great referral source to us. They see you in the office and find a wound, and then they refer you to wound care. We can recommend you for lymphedema pumps. We can measure you for compression wraps. We have a wheelchair company we work with to get you offloaded appropriately for pressure ulcers. Highpoint Health Wound Care at Sumner offers hyperbaric. Those are wounds that can be treated with hyperbaric oxygen for wounds such as diabetic foot ulcers or failed flaps, osteoradionecrosis. We've had some radiation cystitis. Radiation does injury. A couple years down the line, you have difficulties and you come see us. Love the beach. We love being 7 hours from it too. My sister, like I said, is in Smith County, and my niece and nephew, two of the people I love most. So yes, we love to travel. Little weekend trips to the mountain, but definitely to the beach is probably our fun outing for the year. I have traveled with my church group plenty of times to Uganda. We do medical missions out there. That's near and dear to my heart. My missionary friends out there still contact me if they have any wounds that come up. And so we do telehealth from Gallatin. Thanks for taking the time to get to know me. Hope to see you here at Highpoint Health Wound Care at Sumner or Riverview.